Our recording. Great. All right. So guys, this is ICOM. This is Ellie Matthews. This is the ICOM recruiter extraordinaire. Wonderful person.
I'll introduce.
Okay, you introduce these. These guys are in their second year. That's all I know. All right. So let's get started. Ready?
Okay, perfect. I'll show you places.
Okay. Here. Come here.
Okay, so can I? Hi, I'm Ellie. I'm the recruiter. If you're online. Okay, actually, can you maximize it? Because I'm going to move it to show who they are. Okay, perfect. Sorry, everybody. I'm going to let you.
So confusing.
In person, I've never done an in-person presentation, and I've never done. Well, okay, I've done an in-person presentation. I haven't done in-person plus virtual, where I'm in person, if that makes sense. So I'm Ellie, I'm the recruiter. We're going to talk about the Idaho College of Osteopathic Medicine today. I am going to introduce my two med students with me today. I'm going to have them actually come up. I'm going to like put the little camera on you as well so they can see who's talking. Okay. Patrick, I'm going to have you come up first.
Are we moving this way?
No, you're
Hi,
good.
everybody. How are you? My name is Patrick Cranor, and I'm a second-year med student at ICOM. I did my undergrad in health sciences, and I went to a somewhat large school in Central Florida, UCF. So had a pretty important football game a couple weeks ago. Very happy to see the result. Yeah, hopefully nobody hates me now.
You're done.
You're done.
My name's Nathan. I am a second year also, and I actually my undergrad here in
Nice.
graduated in 16. So Patrick can sit down and we forget about him for the rest of this time.
All right. Okay. So they're going to actually. Oh no. Oh. Oh no. I think we're good. If I don't touch it, we're fine. Okay. So I'm going to actually have them join me in my presentation today. And while I do it, they're also going to do a demonstration today, which is going to be super exciting because we all want to know about OMM and what that means for your medical education. So first off, though, I'm going to cover admissions. I'm going to cover why is ICOM here, which if you go to Boise State University, it's a little bit more understandable versus when I'm presenting to places like Florida. We don't want to talk about Florida right now, right?
No.
Okay. All right, so let's start off. I need to make sure that you guys can see me and you guys can see me. Let's start off with why ICOM is here in Idaho, because if you're not from the state, it kind of is a little bit random that we do have a medical school here. Growing up here, because I am from Boise, Idaho, I never thought that we would have a medical school in this state. We're very driven by our mission, which is to train osteopathic physicians to care for people in Idaho, Montana, North Dakota, South Dakota, Wyoming, and beyond. And so whenever we mention the 5-state region, that's what we're referring to, is that 5 states I just listed off. If you see, the people here can't see it, but there are some stats at the bottom of the screen. If you're online, you can see it. But Idaho ranks 45th when it comes to primary care physicians per capita and 49th when it comes to physicians per capita. We're in a dire need for physicians. We have a physician shortage. And this 5-state region is really the last epicenter, if you look at it geographically, for physician needs in the US. If you aren't from Idaho, that is okay. This is an infographic of our class of 2025. If you focus on the country, the map of the country, you see some orange dots. That is where all of our students from the class of 2025 are from. You can access this on our website at idahocom.org, and you can see it a little bit closer. You can see our feeder states, our feeder, excuse me, not our feeder states, our feeder schools. You can see our diversity, you can see some stats as well. But just because you're not from the state, or maybe you're not from the 5-state region, doesn't mean we don't want you at our institution. I'm gonna go through, yes, what? You waved? Oh yeah, because he's from Florida. He's from Florida. This is so weird. I'm trying to be like, hello, hello. Okay, as you can tell, I'm also not very stuffy when it comes to presenting or being a recruiter. I'm pretty low key. But let's go over some admission requirements. There's a cool thing about Boise State University where we have an articulation agreement with them. which means that if you hit some metrics, you're automatically granted an interview if you complete the application process, which is a win-win when it comes to medical school applications. It's a fantastic opportunity to have an interview, to be in front of the people that are basically you're trying to get into the school with. So what we look for admissions, we look for a 3.2 cumulative in science GPA. That is more of a competitive GPA metric because GPA is so not standardized. You could have a really poor undergrad and get a master's degree and do phenomenally. You could have an upward grade trend. Maybe you really didn't know your passion was being a physician and you tried to change it mid-time in your educational career. So that's why it's a competitive minimum. The next metric is an MCAT score, and that is a standardized test. And that actually is a strict cutoff. We've implemented that this year for our application cycle. And that strict cutoff is at the 50th percentile with subsections at the 35th percentile and above. So right now, if you're thinking like numbers, that's a 502 really, because a 501 is a 48th percentile and a 502 is a 52nd percentile. So after that, these are just kind of basic requirements that you have to have. We have letters of recommendation. If you're applying this cycle, then we only require one from a PhD holder in the hard sciences that knows your academic abilities. If you're applying next cycle or in the future, always assume 2 letters of recommendation, one from that PhD holder and then one from a physician, and it can be an MD or a DO. And we do that for COVID. We only have one for COVID because it's so hard to shadow a physician. And so we don't know how long COVID's going to last. We could waive that again for the future cycles, but it's better to be more prepared than less prepared. So just always assume 2 letters of recommendation. And then finally, there's some required courses or prereqs. And for us, we require biology, organic chemistry, inorganic or general chemistry, physics, and English. So you're going to Boise State. If you hit those metrics, you complete the primary and secondary application, you're automatically granted an interview. Even if you apply August 1st, 2022 or 2023, which is our last days of the application cycle, you are automatically granted an interview. So it's always better to apply earlier than later, but that is a really nice thing that we have in place with Boise State University. All right, so that also kind of brings up the fact, like, what do I do beyond just those metrics? Because those are literally just GPA and MCAT and like some required parts. We don't require anything beyond that. So how do you stand out as an applicant? How do you, even though you're granted an interview, this can also apply to other schools that you might apply to. So this comes with experiences, health-related experiences, your employment, your extracurricular activities, your volunteering, achievements, presentations, honors, whatever it might be. That shows who you are as a person and shows who you are beyond those required metrics, beyond your education. What can you bring to the plate? If you worked, I don't know, in the bowling alley here at Boise State, that's not medically related, but you can transition it into being relatable to the medical field. You have to have teamwork, you have to have responsibility, and all of those things translate into being a great physician in your future. So think about, if you're not applying just yet and you're getting ready to apply, list everything out, utilize your pre-med advisors because they know what they're doing, they really do. And they'll help you out with making sure that you're filling out all that you need, making sure that the personal statement's great, and making sure you can stand out as a star applicant because Boise State students are literally the best.
Yeah, we are.
Patrick. All right, so from there, that's kind of like what we look for. Now, I want to talk a little bit more about ICOM in general, and I'm going to pass it on to the students. We're going to talk about osteopathic medicine. We'll talk about curriculum and rotations and a little bit more after that. So with osteopathic medicine, really quickly, we're an osteopathic medical school. When it comes to going to medical school, you have 2 routes. There's allopathic and osteopathic. So your MD route and then DO route, both licensed physicians. You can specialize in anything you want to. So I'm gonna have the students take it over. You work the camera. Okay, thank you, thank you. I'm gonna hand it off.
Yeah, and so really a lot of what a lot of what Ellie touched on is really two paths and really what's the difference for people. You know, a lot of people don't really know the difference between it, and honestly, it's very much the same thing, especially nowadays. So there is some similarities, between DOs and MDs. The biggest difference really is the DOs approach is holistic. We also have an additional 300 plus hours of hands-on training, manipulative medicine, anatomy, applied anatomy, because that's basically the strengths of what we like to do. So instead of just aggressively handing out pills and strips to everybody, we try to find if there's another issue that's causing the problem that we can fix simply by realigning a part of the body that might be off. So I think that really hits on a lot of what people's desires are, other than going to Walgreens every 3 or 4 weeks.
Yeah, and we'll pass it up. It can't be understated, that allopathic and osteopathic, our first concern is goal for the patient, right? And we are trained on the medical side, allopathic, so we have the same systems, we still have GI, renal, and all that fun stuff. We still have farm lectures, we still have microbiome lectures, but we have an additional longitudinal course. So the first 2 years hands-on, and then next 2 years is a little bit different, where we do kind of take lessons that we take in the anatomy course and we apply it, right? How can we take what we saw in the cadaver and apply that to real life? And so there's definitely some misconceptions, I think, in what we do. We have somebody who's coming in and they're having an active heart attack. We're not going to be like, all right, let's look at your back. Like, no, we're going to treat first, and then in the rehabilitation process, or maybe there are some manipulative things that we can do to help the patient. We have different, for an OB-GYN, we're talking about liver, and there are different things we can do to help induce, but then also help in the post-delivery state. So it's just another tool in your toolbox. Education-wise, it can't be understated how you will get a quality education, and you can do some really cool things every single day. So, do you guys have any questions? I think people in the room, like the difference, and be as open as you want. We're both here to talk to you.
Sure. And we can save a lot of them to the end too, if you guys want. If something pops up in your head, write it down.
Or just raise your hand too. Like,
Yeah.
I'm a talker, but it's a.
You want to talk about day in life, or?
Yeah.
Okay.
Are we going to do the demonstration afterwards?
Yeah, we can do that.
Love that.
Probably
Okay,
good.
perfect.
Yeah.
All
Yeah,
right.
so just briefly, we're a systems-based course, longitudinally for the first 2 years. They're didactic, which means in the classroom essentially. And then you're going to go through every body system from what Nate was saying with your endocrine. It's going to be your anatomy. It's going to be first. You're going to be day one. You're getting in the lab and you're doing a cadaver dissection. And we work with ISU right next door to us, who provides the anatomy lab for us. And then you're going to move on to neuro. You're going to move on to musculoskeletal. You're going to move basically all throughout the entire body by systems. And the way that it's set up with systems is it's longitudinal. So everything sort of builds on itself, because not one system of the body is by itself, right? So everything's interconnected. And so at the end of your second year, you start taking boards, and then you move on to your third year with rotations around the state or here, or any in the 5-state region. And then your third and fourth years, you'll take some more boards and apply to residency. And as we were saying too, the residencies are merged, and we're in a bit of a flux right now because we're not really sure what that's going to mean as of yet, but it seems like everything's working out okay now. Who knows what the future is going to hold?
Yeah, and so that's sort of the macro picture, right? So the micro picture, what's your day like? Your first semester, you're kind of thrown into it. You have 3 courses that go over each other, but at the end of the day, if you're there, if you're in the building, you have an immense amount of support from the top down. From day one, the faculty has gone out of their way to support y'all. And that's going to be the biggest thing is no matter what you're doing now, it is successful, right? If you get yourself in that door, if you're in a position to really make an application, you've been successful, right? Your first day kind of gets thrown away a little bit. You're like, oh my gosh, what the heck is going on? This is like self-biogenetics and epidemiology, and that's in the first 7 minutes. But you adjust. and you learn and you grow. And again, it can't be overstated that one of the things that I think really ICOM does exceptionally well is provide you with a support structure that starts at the top. It starts with the president of the school, Dr. Farmer, the first day, down through Dean Moore, and you will feel support. You're all academically, so you're academically proficient, and so it's a matter of cultivating some of the skills that you're learning now here to then become successful there. So a day in the life, you have about 4 hours worth of lectures a day. It changes a little bit. You may have a couple of labs. So in your first semester, you'll have an anatomy lab that you go into twice a week, and then you also have an OPP lab. And we'll show you the end of class, or we'll kind of show you, tell where my brain's at, right?
Yeah.
We'll show you a little bit about what we do in the OPP lab, which is the manipulative portion of the courses. And then you move through it. After your first semester, you're done with anatomy. You're done with anatomy. Every single block. And then, so right now we're in our second year. We worked our way through mental health. Was our first block in the active. We're in the middle of GI. And so, and so, you know, I think they say in undergrad, you know, every hour of coursework is about 2 hours of studying. I don't know how true I never really saw that to be. In med school, it's about an hour, it's about every 3 hours of studying. There is quite a bit of off-camera time that you do spend, but you're doing what you love, right? You're studying the things, you're working through the things that are really important to you that brought you to that point, and it makes it easy. You'll have a group of 161 other people. I say easy, not easy by any stretch of the imagination. But you have a group of people who are going through it with you, and that's the other thing I wanted to highlight about ICOM is that I mean we're the pandemic class, right? We have not had one moment of our medical school career that has not either been virtual or hybrid format or wearing a mask. And our first year, we didn't really get to know each other. But once we did start to get to, there's not been one individual in our class who's been the gunner, right? I want to be an orthopedic surgeon, and I'm going to get an A in everything. I'm going to step on every. We don't have any of that. We have people who collaborate, we have people who build, and again, that starts at the top with our administration, and really, the admissions team does a great job in, you know, making sure that you're going to get the support in the class and you're going to get support from your colleagues.
Yeah, I'll say for sure. And just to echo that, I mean, I'll tell you right now, if I went to anybody that I haven't met and I was like, man, you know, I didn't do so hot in that exam, or man, this block's killing me, the first thing they're going to say is, what are you doing? How can we get this? You know, what can I help you with? What are you missing? Things like that. So the collaboration is huge. Even as Nate was saying, we're the pandemic class, we were virtual for a lot of it, and so we didn't get to foster it. But the fact that we still didn't, and then there's still this collaborative environment, it just really speaks to the volume and caliber of people that they brought in. So not to like bump you, but you know, I think it's well deserved. So.
So any questions? We sort of shift the move through. What was it? None in the chat. Question? Yes.
So I think that happens. Or yes, transition to clinical look like in terms of here, you can look around. Are you applying for different sub programs in different areas? Or you just say, I want to go to Montana for 2 years and not go to 3 years.
Perfect question. So the way the clinical work is, we have clinical sites that work in. So that is, you know, in the Treasure Valley, which we say Treasure Valley, but that can also include Ontario, include Mountain Home. There's Treasure Valley, Magic Valley. There's a few in Logan, Utah, Eastern Idaho, Wyoming, a couple Montana, South Dakota, and one outside in New York. And the way that it works is it's almost like a prep, right? So you have opportunities to meet faculty directors that are over all the sites and tell you the sites, what subspecialties you like. So say you just really love GI surgery, okay? You just really want to be a GI surgeon. Well, the Great Falls, Montana site has a surgical subspecialty that has that. So you go through, you say, all right, I'd like to go here. There's then a lottery system that takes place. Now, if you went to high school, high school diploma from a state, as of right now, totally can change by the time, you know, you're coming around. You would be able to get that spot. So let's say you're from South Dakota, you really want to go back, you have your high school diploma, and then you would be eligible to get into that site. Now, you do your thing. Throughout the third year, you're going to rotate through a series of blocks. So you're going to have an OB/GYN block, a family med block, a mental health psych block. And those are all going to be set up for you by our third and fourth year rotation site team. Come fourth year, you get to have more electives. And so say again, you really just want to do GI surge. You can at that point say, you know, there's this really cool program in Oregon. I want to do my residency there. Our team has really been exceptional through our first, fourth year group at setting up those sites with them. So it's not just, you know, kicking you to the curb. All right, go figure out how to set up all these locations. You're going to be supported the whole way through. Does that answer your question?
Yeah, so just to clarify, that first year you have like your set block curriculum you can go through.
Exactly.
Your last year you have a little bit more mobility.
Exactly. So your third year is, you have to hit a certain amount in order to take shelf exams. So at the end of each rotation, you take a shelf exam and then you move on. Eventually, there's accumulate into enough to matriculate a degree for you. Then you get through us. Once you get through those recs, then at that point you get to shape your own. You get to do like some working interviews. And so, like I said, say that school in Oregon, that's where you really want to go. Well, that's your working interview. You get to meet the residency director and get to do the things that when residency applications open up at the beginning of your fourth year, you can then take that step and try to do those things.
Yeah, and then the start for if you don't have a preference for any state, then it's a lottery-based system. So you're going to do a ranked list, and they're going to literally draw your name out of a hat, and whatever your site is, if your number one site's still available, you get that spot.
Okay.
So they said too that statistically, most people, around 90+%, get one of their first three choices. So pretty fair in a sense. There's not a lot of preference when it comes to. There are some extenuating circumstances that you can talk about, but they try to keep it fair between like those that are like single and just out of college or just out of their bachelor, that are just starting into med school versus those are more non-traditional students like myself, married with kids, things like that. So not one person can have an unfair advantage. Having a child is not an unfair advantage, essentially. So this is a journey for everybody, and they try to put everybody in the bucket and keep it as fair as possible. And I think for the most part, it does pretty well.
So what we got behind it, and these are the sites that I was telling you guys about. So these are the established sites that we have throughout the country. So like I said, a couple in New York, in Boise, in Treasure Valley. Pretty good, actually.
They're all in the 5-state region. And then the two that represent the beyond, we did this on purpose. Like they were saying, is Long Island, New York, and London, Utah. So if you kind of think about that pattern, they're all pretty methodical.
And then we go back to the
Absolutely.
okay, so this is what you are looking at for your third year. And so again, I know it looks like a lot that you're going to go through. It is a full calendar year that you're going to spend throughout these rotations. And then that fourth year, you get those electives. And so those electives are for the surgical subspecialty that you really like, or the IM specialty that you really like, or the family med. You go to family med, right? Yeah, I really want to be in Boise. Well, let's get you over there into that family med. Let's give you some hours, some touch hours with the residency director. So, and again, like I said, it looks like it's like, oh my gosh, I'm so jam-packed and look at all this free time I have. It's not. You're going to be getting your residency applications ready. You're going to be doing all the things you have to do then the first year resident. So,
And one thing too, I wanted to touch on too that I forgot, and I apologize, when we were discussing differences in D and DO as far as residencies and things are concerned. Like I said, the residencies are merged, so it's the exact same residencies you go to, but also to consider mission with the school is to increase the amount of physicians we have, particularly family med is one that's really low that's represented. Traditionally, MD students, less than 30% pick family med as their residency choice, and DOs greater than 50% pick family med. So you can kind of see where the trail off is and why there's so much focus, why there's an osteopathic school built here, and what the need is for the community, for the state, for the 5-state region, and why it's so important to have the school here for an osteopathic program.
And I will say, it's a little awesome to be on an island. Yeah, a proverbial like medical island, but boy, the things you get to do in your third year when you're in Sam in Idaho, there's one doctor and it's you and him together. The things you guys get to do will blow your minds from a third, fourth year perspective. I've got friends who are doing their rotations now that are like going right from the hospital to being treated like you're in a position to share your colleagues under the purview of some really exceptional mentorship. So like you said, sometimes it's a little odd, right? Boise, kind of like an island, right? We're 8 hours from Portland, 10 hours from Seattle, 12 hours from Vegas, if you go the Utah route. And it's like, oh my gosh, there's nothing else around. There is every opportunity to sharpen your tool set early on in your medical career. And so I think it's kind of a cool one.
That was perfect. Okay, do we have any questions about your years at ICOM? Like they were saying, first couple of years, you are on campus, and years 3 and 4, you'll be out with rotations. You're always going to be checked up on from the school, obviously, but do any of you have any questions on any clarifying information?
And just talk, like I said, we're here, I mean, have a conversation, like this is, it's, we're here to hang out with you guys, so.
Yeah.
That's,
Ellie's laid back, we're laid back. too,
Yeah.
So this is not having formal or anything.
You guys said you're in your third year,
So,
second year. So how's the experience been so far? Especially like scheduling and just making time for stuff around your life, I guess.
pretty intense.
it's, you know, there's a lot. In medical school is a lot. Like I'm not gonna lie, you'd be like, oh my gosh, that's not your time. I mean, I've got 2 dogs, I've got a little life outside of it, and you do have to make some sacrifices. But there's nowhere to be. You know, like when you're even at the worst days, when you're like burnt out, tired, and you're grinding, you're still doing what you love every day. Right? You're still every single day there's something that is in your curriculum that can save somebody's life. And it's kind of humbling, right? Like it's a little weird, but it is a pretty unique, it's a unique opportunity and one that I think when you're in the weeds of things, it gets harder. You're like, here's what you're in, freshman, sophomore, junior, senior, for sure, senior. Graduated. So like, you know, when you're like in the middle of it and it's like, I'm so busy, I hate this is miserable, like I don't care about COM 112, I don't care about recent discourse at all. Well, I remember that's COM 112, Marty Most, great teacher, I don't guess I but you know, you have those moments where you're like, this is just miserable, and then you kind of take that step back, like this is kind of cool. Like I'm here learning what thousands of other people want us to come do, it is your home. And that's kind of how I've taken the med school approach. And it's 4 grueling tough years, followed by 3 to 7 grueling tough years, followed by a lifetime of a rather intense lifestyle. But there's nothing else you can do. It's yeah.
So, and you can make of it what you want of it too. So, I mean, considering, you know, it's like a draft pick essentially, you know, if you're a football fan. I mean, there's thousands of people that want to come to school and you're in that position, you're in the seat. So make the most of it. And yes, it's grueling. Yes, you're just getting inundated with information. You're drinking from a fire hose, and there's a lot of things that you're going to want to do. You're not going to be able to do because you have to study for an exam. Yeah, like football games here. But I mean, you gotta realize the situation you're in, the commitment that you're taking, and what you want to do and what you want to make out of it. And you'll have time that you can still do the things that you'd like to do. You just have to find a way to balance it. Like I have a daughter who's 6, she'll be 7, she's in 1st grade, and she's like a soccer nut right now. So I mean, there's games, there's practices, and I can't make them all, but honestly, the ones that I can are so much more important for us. And so like we understand that as a family unit, but then we know like when time comes where I have free time to play hard. So you know, you work hard when you have to grind it to school, and then when you get time off, man, enjoy it. So really, that's just kind of our advice piece.
And you will get out of life, like you absolutely will. Like it's such sacred time. So like whatever that hour, that 2 hours is to you. It is so sacred and it is so preserved, and don't lose it. Like if you go to school at ICOM, if you go to UW, if you go to wherever, be a human. Like there is nothing else. Like nobody wants a doctor who just sits there and just kind of talks like this the whole time because they're miserable, right? Enjoy it. Enjoy your mid-20s, 30s, 40s, 50s, however. We have people in our class that are in their 50s.
Yeah.
Bonnie is a killer, but she's
I'm 36.
awesome.
She's so cute.
She is the best, and she has the best perspective on everything. You
Yeah.
wouldn't even be close, like, you wouldn't even be top 10.
Yeah, we've got a really good handful of non-traditional students at our school.
Yeah, I'm 36. One of the guys that was in my anatomy lab, he's 35, and we're all from different areas. He's from Chicago. And
Most of my class is 21.
yeah, there's a guy that had his 21st birthday. I'm like, come on.
I think once you're in medical school, and I'm not speaking on behalf of students, but this is just what I've seen. Once you're in medical school, you kind of realize that no matter how your age is, like what your age is, you're surrounded by like-minded people. And that's kind of where I feel like maybe age kind of rounds off into the abyss a little bit. But with non-traditional students, they do offer a lot of really great maturity, a different aspect of mentality. And so you'll ask any osteopathic or even allopathic recruiter, first of all, it's illegal to consider age even with applications, but we highly encourage anybody of any age to apply. There's no too late
Absolutely.
aspect
to follow your passion.
Yeah, I'll tell you guys too, what set me in motion for it was prior to this medical school, I worked as a paramedic on an ambulance. And one of the docs that I would transport to the emergency room, guy always seemed like he knew his stuff. I mean, he was just Johnny on the spot, like just a phenomenal human being. And I sat with him one day and I was like, man, you know, it's like, you picked up on whatever problems like that. So you must have been doing this a million years, man, because he's in his 70s. And he's like, no, he's like, I worked as an attorney. I had a full career as an attorney accountant. And because I retired as an accountant, I got bored and went back to med school. And he was in his 4th year out of residency in his 70s. And I was like, well, I'm only 30 at the time. And I was like, I guess I can actually pursue this. You know? So
We've got a
Yeah.
couple PAs, we've got a couple
Yeah.
PhDs in our class, we've got a couple of chiropractors. So we've got a really great array of people, but do any of you guys have any questions from what it looks like we've got a chat.
ooh, chat.
No.
No.
I was like, one from the interwebs.
Okay, so if you don't mind, I'm going to introduce the next section really
No.
fast. Part of being a student at ICOM is your ability to do things beyond your educational experience, and that tends to be student organizations, maybe even furthering your education, like our MHA, Masters of Health Administration, or Masters of Public Health opportunities that you can take advantage of. But Patrick and Nathan are also members of a really great student group on campus, and it's called ICOM Soma. So I'm going to let them kind of explain what that is and why it's important to be involved in student organizations, maybe a little bit about potentially thinking about starting something. I don't know. So do you want me to hold that? Oh, it's okay.
All right. So Soma, we are part of the national organization, which is Student Osteopathic Medical Association, Soma. And we're the external, right? So there's Student Government Association, and then there's Soma. And so we deal with policy. We deal with how DOs are represented in the community. We have DO on the Hill Day where we go and speak with local Congress people. And one of the things that Pat and most of Pat is he is pre-Soma. I take a role of many hats, but he's developing and works with to create a pre-Soma program. And what that is it gives you guys, would potentially give you all an opportunity to be involved, to get some connections on campus, and to be able to do things for Boise State to hopefully help cultivate not only your guys' experience here, but then also as that translates into medical school. And again, whether it's osteopathic, allopathic, it's an opportunity for you to grow into your leadership roles. So if you want to talk about.
Yeah, for sure. And just to highlight that too, the biggest thing that's really afforded, especially for Soma, for us, is to have a voice. As a student, as an osteopathic medical student, and by that voice, we also can write resolutions that we can send to get evaluated, to see how the medical community, the educational side of it, is going to be, I'm sorry, I'm trying to explain, but it's going to be like put out into the community. So we like our voice to be heard because a lot of people don't know what DOs are, and we're students of that. So we're trying to get our name out there and to really show people like there's another option. There's maybe some would argue a better option. I'll stay neutral, but I am partial and biased. So,
And to give you guys an idea, not to interrupt, but like the last 2 presidential private physicians, like the president's doctors for both Trump and Biden, regardless of political ideations, whatever, 2 different political spectrums, both teams. So it's not like you're this niche kind of hole in the wall. Like there's a fair amount of
and there's certainly a lot of political advocacy that can be afforded to you with Soma, if that's what you like, if that's your goal. There's other areas. For me, I personally don't have use for politics. So where I saw my role is more the pre-Soma area. So I can sort of get our name out there and get students interested, and really kind of bring to light what pre-Soma can do for you as an organization. It really just kicks you off and gets you ready to go right into Soma for an osteopathic school. The things that we like to be able to do is we like to do a partnership with mentoring. So if you guys have questions, you don't have to try to Google it. You can go to Student Doctor Network, and if you stay off that.
please do Reddit, SDI.
Yeah, all that stuff. But it's so much better to hear from a person, from someone that's actually in it, than maybe some disgruntled person on the interwebs. You know what I mean? So we want to establish mentorship programs, and by that I mean like as far as us personally as a school. But with pre-Soma, you do have the option of doing mentors through Soma's organization on a national level with the website. They compare you, you sort of list your likes, dislikes kind of thing, and you put your long walks on the beach that you like, and they'll compare you with somebody that also likes long walks on the beach, and you can talk about how you're preparing to apply to medical school. So really for us, it's about what we can do in the community, what the community sees of us and how to present ourselves. And so if you want leadership opportunities, it's definitely a great spot for it. If you don't have a lot of leadership experience and you're maybe a little shy about it, or you're not really sure that's what you want to do, it's a great way to get your feet wet for sure. So you're gonna have an opportunity to see where you stand and what your values you think they are, and how you can challenge your values to make yourself a better applicant, a better medical student, a better physician, if that's the route you want to go. Yeah, better human, definitely, definitely. It starts from the inside.
It does. And quite honestly, the driver behind me being at Summit is for y'all. Like, I love Boise State. I mean, I'm the biggest fan, and my 4 years were wonderful. But it was hard, right? Making that jump. You guys are in a really hard place right now, right? Because you're trying to balance all of these things. You're trying to balance a lot of advice, and whatever you want to do. If you guys are like, I want to go to medical school, don't do it, right? Don't let the negatives like override whatever you're thinking. Like, you have to do it, even if it takes you a cycle, 2 cycles, 3. It doesn't matter once you get there. Okay, so keep your head up. Don't let any of it like kind of bog you down. It's hard. It's really hard. The applications are long and hard and expensive and expensive and expensive and expensive.
But it is nice at that point that you do get, if you meet the mentors here, you get an interview with Icon from Boise State. That's huge, because I'm telling you, like you said, the applications, $50 to $100 a shot. Secondary application, $50 to $100 a shot. And if you apply to like 30 schools, you see the numbers adding up, and you may, what's the payoff that you're going to get? Whereas here, you got one application, you got a secondary application, you have an interview, which is beautiful. Like, that's instant gratification. So not to like pump that, but I mean, man, that's awesome.
Do you guys have any questions? And like you said, this is a conversation. Just don't think about this like as some people are recruiting trying to come in, like, you need to ask anything. Like, we're here to support y'all at the end of the day.
What are some of the ways that you guys are involved in the community?
That's a great question.
Hold on, can you repeat the question? Because Patricia, Pika, and Kylie, they might not be able to hear that question.
Okay, so the question was, how are we involved in the community? And we have several different ways that we're involved. Obviously, COVID has been a challenge, but with that being said, we have regular volunteers, the Idaho Food Bank. We have regular participants at the various races and charity events that are going on. At the Pride Festival, we had booths out there. We were participatory. We're partnering with the Humane Society, where we go and volunteer over there.
And the park we adopted as well.
Exactly, we have a park we adopted a highway. So where we break up Boise. And so really, and the nice thing is, it's like, these are what we've been able to do in the last few weeks, months, because again, COVID kind of like did a hard reset. But whatever you are passionate about, like if you have volunteered at Food Bank and you're like, this is what I love, this is the people I want to support, there's an avenue for that. And there are people who will make it happen. Heck or high water will make it happen. So there's several ways within the community. We really do try to be involved with it.
The food bank is definitely one that I'm super passionate about, and I'm glad that we have the opportunity to do. For me, it's kind of full circle because, like, when I was young growing up, like we got our meals from the food bank. So to be able to go back and sort of do that same sort of meal prep planning and pulling and organizing things for somebody that was in my situation, years ago and now current, was really a beautiful thing, and I'm super fortunate to be able to do it. And then, any passion that you have is in the community, we have an avenue for, we have a partnership with. So our main focus is make the space beautiful, make it amazing, make it wonderful to live here, make it wonderful to be seen here as a patient and to be a physician to see somebody.
Did you have a thing in mind? Or is there somewhere that you work with?
I haven't been to YMCA in the past.
Okay.
We have blood pressure checks at the YMCA.
Yeah.
We do that pretty regularly.
Yeah, we have Family Health Club who does it, and then they will go in there and help with blood pressure checks and some pretty minor screening things that we could do sort of remotely. But yeah, Dr. Bates, who runs that. So yeah, we have a guy. I think you're gonna hear us say that a lot. If you have a question, we have a guy for it. That's
We do it like this.
yeah, something like that. That's the other nice thing is that we have a phenomenal physician pool. We're the only school in Idaho, and so yeah, the best ophthalmologist, he lectured to us for like 3 straight days. Oh, the best derm guy in town, yeah, he's lecturing to us at the end of the month, and they're helpful and they respond to your emails. So that's the other super nice thing is that, like, there's not a bad environment. They want to give back. Like once you're in the circle, you're in the circle, and they'll help you get to the circle. Do you guys have any questions before we move on to the OPP, OFT portion? And I think just ask away. Just like how I was here.
I don't want to toot my own horn, but like you also can help out with recruitment, just like these guys are.
Yeah.
Yeah, that's one
Get
thing.
my
I
good
think-
graces.
Yeah.
Come with me.
And then get stuff from them.
Yeah.
Yeah, I've done a few of these with Ellie, and I will say it's awesome you guys are here because this is my first time talking to a live audience, a live crowd, as well as virtual. So this is a fun experience, and it's awesome to see people and be able to feel their presence in the room versus, smiley face, emoticon, thumbs up kind of thing.
Yeah.
All right, cool. Well, we'll move on to our OPP demonstration. And so really, guys, what we'd like to do is, I'm sorry.
I'm gonna manage the camera.
Yeah. A lot of it.
Spin a kiosk and leave it on the monitor.
Oh, maybe.
Potentially,
I think it's on a station.
I kind of need to like put it up a little bit for them to see it. So we can minimize it so you guys don't get dizzy. But for them in the recording, like you kind of have to have it up a little bit
I'll just look it up.
in case they do like certain things. Will you minimize it a little bit? Sorry for those who are like,
Or the two main representatives, student representatives or ICOM.
For pre-sale.
Let me make it a little bit smaller.
Yeah.
Let me make it a little bit smaller.
And treasurer as well, and a national liaison. So majority of medical schools have a similar representation as far as the Osteopathic school, and they're broken into regions. So ours is region 5, and we have communication between all the regions as well as our national community, kind of is the one that funnels the information back and forth between our national liaison, our national group. So we're just the guys that are going around talking to schools.
Ellie's got like 30 people on her list. We were just the lucky ones that got talked to today.
Oh, yeah, that's true.
Actually,
No, I mean-
we had to submit an application, we can verify.
But if you
Oh,
want
for
to be
the
involved in
ambassador
the process,
program?
no, there is more than
Talking about
just
the ambassador
people.
program.
No, no, it's you for this.
That's true too. You have to be in my good graces. Okay.
All right.
All right, cool. So we'll get right to it, guys. So basically, when you start with somebody, you want to start with a minimally invasive sort of protocol essentially, but you have to start like a screening with somebody. So if it's somebody you just meet for the first time, you kind of got to go from the top down, and you're going to go from the outside in. So really, you're going to check somebody out, and whatever their problem is, you're going to kind of go skin surface level first, and then you're going to move in. So what we're going to do though is, because some of that stuff takes a lot of time, we really don't have a lot of time for that. We're going to show you like some of the cooler like treatment modalities. I'm going to watch that. So
A couple of the easy ones that.
yeah. So there's several different techniques. There's and most of them are named after the pioneer, the one who developed it. And the first one I was going to show you guys is a still technique by Dr. Andrew Still, who is the guy who basically invented osteopathy. He was an MD too on top of it. He wanted a different route to take versus what was traditional at the time, which is cut people's legs off if they were infected and stuff like that. So
It's like the 1800s. So
Yeah, yeah, yeah.
not within the-
It wasn't
Yeah.
just yesterday.
This was in the 70s.
no.
Oh my gosh.
Right. All right, so really this technique is really good for sort of like a bone issue, a bone out of alignment, and this is going to be any kind of gross popping or anything like that. It's just going to be really sort of letting it shift where it needs to by putting him in a position to where it's going to move that way. So a lot of these issues are something simple, right? Like this first technique is for your first rib. So your first rib is above your clavicle, and I'm not going to give you guys a long anatomy lesson or anything. I'm just going to shoot some text. And this issue can really happen if someone's a side sleeper, their arms up over their head, and they wake up, their neck's killing them, their back's killing them. Like, what's going on? I slept on. I might get your ribs out of a little bit of alignment. And this is just going to be a demonstration, but if you guys have something that I find that I'll probably try to fix it real quick. So when you're going to check somebody out, these are the tools that you're going to use, these guys. So you really want to make sure when you start that you're trying to really work on your palpation skills, because you can feel more than just somebody's skin, than just somebody's any like fatty layer or anything like that. You can feel more of that with your fingers and your hands than than just what you should be treating with. So make sure, like when you're doing it, you're really working on your ability to feel things: skin, fat, muscle, bone. And so for this type of procedure, what you're going to do is you're going to feel for his ribs, his first ribs, which it's going to be weird with me kind of in front of you guys, but I'll just kind of try to stay to the side a little bit if I can. And these are really kind of high up, you see, because his clavicle's right here. And then you just kind of push on them and see if there's one that moves a little bit better than the other one. You know, and so typically you'll feel a resistance to it. So you'll kind of feel like some of it springs a little bit better, like a diving board, which is the way it should be, but if it doesn't, then you know it's an issue. And so for this, I just had to kind of slide a little bit over. I know. This one was standing, it's probably a little bit easier. So for this one, what you're going to do is you're just going to keep your hand on that spot that was a little rough. It was a little not as bouncy as it needed to be, and it's called a restriction. And then what you're going to kind of do is you're going to use his head to move around and see where you can make it the worst possible, but without causing pain. So I'm just going to kind of bend his head a little bit, maybe this way, and see, okay, well, you know, this rib likes to come up when it's over here all the way. This rib, and it goes down a little bit when I bend his head that way. When I turn his head, it's a little worse over here. Not so bad. And then bend him forward. And really the whole time you're just kind of feeling that rib, and it kind of just feels like it's kicking up on you, on your hand. So really for this technique, what you want to do is you want to pull away from what might be the aggravated site. And so you can kind of give it a little bit of time to just sort of reset itself and feel. And then at the same time, what you're going to do is you're just going to put a little bit of force on his head. And I'm going to show you guys and then I'll do it. But you're going to incorporate all those same movements I did into where you're going to move his head as well as flex him through it and then also bend him that way. So you want to kind of do it all in the same motion. So what it looks like if you're standing here, and I'll put his hand over me. I forgot that. And so I'm going to come down a little bit because I can't put this table up as nice as I need it to. So what you do then at this point is you're going to pull him to where it's a little easier. You're going to add a little bit of force to his head, just a little bit, so you can feel it in your hand. Then you're going to rotate him through it, and then you're going to bring him back, and then you're just going to feel it now and see if it's any better. And typically it'll take a couple of times, and then you might even feel a little bit of a popping kind of sensation, but mostly just a little bit on the inside. It's not like chiropractic was like a snap or like a crack. Really, it's about gentle manipulation. Because anytime you're touching, poking, prodding, you're sending impulses to your central nervous system, your peripheral nervous system. And if I'm really like spending a lot of time cranking on them, I'm really not doing them a good, I'm doing them a disservice to trying to treat. And so then another technique I want to show you guys is for your hips. A lot of problems can happen. You step wrong, or you're lifting and you're not doing perfect or proper ergonomics. You're going to tear something, or you're going to shift the bone out of alignment. And so your hips kind of, if you imagine like the ears, essentially the hips are like this, and underneath the sacrum, and they move just a little bit by themselves, and they have a little bit of freedom of motion there that they can articulate with a lot of the joints. The problem that can come with that is, if you get shifted wrong way, it might stick a little bit. If it sticks like that, it's not in the right place. It's going to be sending all these pain signals to your body. So I'm going to have you do a standing flexion test. So what we do is somebody comes in with back pain or split pain in their hips, or it could be all the way from the shoulders too, because your spinal cord is the one that is the main conductor, the main highway of the body. And then maybe I'll turn you this way so the camera.
That's perfect. Yes.
There's two spots on your so you're on your hip bones that are like little outcroppings of your bone that you're gonna use as sort of your mark, your level, and they're a little bit lower here. And what you're gonna do is I'm gonna have him bend forward and touch your toes, and then I'm just gonna support him, and I'm gonna feel and come back up. If the hips are moving the same direction, if one stays a little higher than the other, or if one stays lower. And then what you're going to use that same information is if you have one stay a little higher, then that's your problem spot, and the issue lies right there. So for his, we're going to say it's on his left. He doesn't have a problem. This is just for demonstration. And then you're going to come and you're going to measure the front, because the same prominent spots on the hips and the back are also in the front. And those are pretty easy to find because they're almost like little hooks. So you're going to hook your hand underneath it, your thumbs underneath it, and you're going to find to see if one of them is a little higher. And that'll tell you that if one of the hips is rotated backwards, forwards, or if it's dropped down some. So this is going to be a treatment if one of the hips is, one side of the hips is a little bit lower than the other. And this can happen simply stepping off the curb in the wrong way. Or you can get it, if you're kicking a ball and maybe you're closer to my age and you're a kickball, when you shouldn't. And so what I'm going to have them do is I'll have you just turn around on your chest and lay down, and then just have your leg off the table. Yeah, from me.
Is it left or right?
Left. Okay. Yeah. So he's going to lay like this, and I'm going to bend his knee a little bit. And what I'm going to do is, and have you hug the table, is I'm going to hold the bone where he sits as ischial tuberosity, and I'm just going to add pressure to it. And I'm going to have you take a breath in, and when he takes a breath in, I'm going to have you take a breath out and push against me. And so I'm going to hold this here as he pushes against me. And the goal for this, what we're trying to do is push his hip back up to the right spot. And I'm not going to put a lot of force on because he doesn't have an issue that won't cause him an issue. But I just want you guys to kind of see. He's going to use the top part of his body to push at the same time he's pushing against me. All these forces are coming this way, and I'm pushing against it so I can push his hip back up. So I have to come right here. Make it a little easier.
Very good.
And so other applications of this are special tests, osteopathic special tests for if there's any kind of sports injury. So that's a big one.
This one. Sure. Take a seat.
Yeah. So
ACL. All right. Here about. You guys ever see on the sideline, like you're like, why, what does it do? Like, they know. Yeah, it takes like a few hours. So again, what's the ACL do? The ACL basically says, you're not gonna come any farther forward, right? You're gonna hold it in place. So again, table's not exactly the right height where you want it to be, but all you're gonna do is you're just gonna grab the tibia, right? Tibia, front bone, shin bone, and you're just gonna pull. Yeah, and so and literally you will see, like if you're pulling forward, right, and your kneecap is here, but your tibia is here, something's not holding it forward, right? Yeah.
Is that the door test?
Yep.
Yeah.
I tore my ACL.
There it is, yeah. So, but that's what, I mean, special tests you can do for all the shoulder muscles, several things. But
Rotator cuffs are big ones, you know, you can bring your arms up all the way, but you get to here, you can't hold them up by yourself and drop them. All that stuff you're gonna learn, it's hugely the applied anatomy. So what's the muscle that's holding us up? What's the muscle that's not working? Is it torn? Is it a ligament issue? Is it an issue with the joint capsule itself? Yeah, is it a nervous issue? So there's literally a ton of applications, and a lot of them have to do with the most minimally invasive way you can actually treat somebody. And you see amazing results on somebody with chronic back pain. Maybe it's not the fact that they have chronic back pain, it's not in their back, maybe it's in where their knee is, the way they're walking. Or maybe it's a problem with, they have chronic headaches and the actual problem is their hips out of alignment. Or maybe it's, you can think of a ton of different situations, but the gold tenet is that everything is connected to everything. So there's fascial layers in your body that go from your toes to your head. And everything is connected, nervous tissue, muscle tissue, and fat layers, everything is all connected to your body. The goal of making your body as healthy as possible.
so, with that, you guys have any questions? I think conversation, you guys have anything you want to talk about? Anything about anything?
So we did like sort of a brief demonstration,
Just to,
just to kind of like the whistle with it a little bit.
you just want to talk about it? How was your guys' day? Smoke's going away.
So I'm an imaging student, right?
Yeah.
And I've noticed a lot of the time, the physician will just, they're mostly MDs though, they'll just send them off to get an X-ray to get a CT. But your guys' lines of medicine seems like it's more hands-on.
So, yes and
How
no.
you guys explain it for you?
Yes, exactly. So if there is a big problem, right? If we have a code red coming in, we're gonna always err on the side of let's get an X-ray, let's make sure we don't have any fractures, make sure we don't have anything out of place. But a lot of times X-rays come back good, MRIs come back good, and patients get frustrated, right? So what tools can we have to give our patients the best possible outcome? Maybe sometimes that is prescription, maybe sometimes that is manipulative medicine. And again, as many tools as you can kind of fit in your little Winco Whole Foods bags.
Yeah.
Oh my gosh, Winco, I said Whole Foods and Trader Joe's.
And honestly, a lot of it is used in constant conjunction with each other too, because if somebody comes in, there's so much pain that you can't even move them without them yelling out, then they do need an NSAID, they do need ibuprofen or something, they do need something to, or steroid, something to get them to a point where you can fix the actual problem. And I mean, there's so many different applications. And my favorite though is, especially with the imaging, is how much radiation do these give off? Not much, right? Or if any at all, depending on where I guess you grew up. Atomic
You're 3 Mile Island.
Oh my God.
Yeah.
Huh?
Yeah.
Yeah.
So really, you can get a really good idea of what's going on with somebody's shoulder with 3 or 4 different manipulation tests. And, do you want to send them off for imaging before they have surgery? For sure. But if they don't need surgery, then why send them to get radiation when they don't need it? When you can find, within, 90+% degree of certainty that the problem is what you're diagnosing of it. And then you can then take that diagnosis and treat them with physical therapy. You can treat them with OMN and use that in conjunction to have a better outcome than somebody that just goes and gets an X-ray and then they get cut open. So really it's about doing the right thing for the patient. And, maybe it's a financial component as well. So you need to run all these tests for somebody just because the hospital says you must run all these tests for them. How are they going to afford it? Maybe they can't. So, I mean, medicine is a big cost driving factor. So if you can sort of consider all aspects of the patient, not just their own physical well-being, their emotional well-being, their mental state, what their area outside of them, their connections with the community, those kind of things are all what you put into the model to be a physician to treat somebody. So that's what I personally like about it, is not just putting the blinders on and focusing on the torn shoulder. It's, you know, okay, this guy does have a torn shoulder or has a torn shoulder. Like, what can we do about it for him? And what's the best way to go about doing it for him so this doesn't get worse, so they're happy, so everything works out the way it should. Yeah, sort of a long-winded answer.
Application of OMM outside of muscle skeletal system, are there any?
Oh, yeah.
So, yes, good example, neuro, the other big one. Those are gonna be your main drivers, the lymphatics, respiratory, we do different things, the diaphragm, to help, safety in patients.
And veteran patients as well.
Cardio, improving blood flow different places. Lymph, again, is the big one. Anyway, you do a lot of lymph. That's my thing. I really like doing so I can tangent myself on lymph for a hot second. But yes, so I would say that pretty. I would say that the only thing you're limited to is your own imagination with things. And I don't mean like make yourself up. I mean, like, how clever can you? What is the actual pathophysiology here? Is it an obstruction? Is it a malignancy? Is it something that, you know, with a little bit better flow, we can kind of help remediate some issues? Do I have an old person who I want to start giving them benzos or not benzos? To my pain meds to help them go to sleep with benzos too? Probably not. No. So again, it's really only limited to how far you want to take the scope of things. OBI, labor delivery.
Yeah, I think that means that can induce labor, but also can make the labor or the delivery process a little bit better, a little bit less traumatic for both the baby and mom. And so with that, it's like it's 100% applied anatomy. So it's, you know which way the muscle goes, you know which way the nerves are going, you know which way the fascia that's covering everything is supposed to move. So how can you use that knowledge to benefit somebody versus, you know, cutting it open?
Yeah.
And we're not anti-surgery by any stretch of imagination. Yeah, but there's quite a few surgical options for DOs. DOs are the same, I should say this, DOs are the same residencies and the same scope of practice as MD. The only difference is the OMM side and the additional 300 hours of manipulation and anatomy that we get. So
it's
why
really good anatomy.
Why would you not want to be the best at what you can be as far as knowing how people work mechanically and you know, et cetera?
You guys all took 22722 here, right? Yeah, it's so different. Anatomy is like, that is a beast of a class. If it was as easy as memorizing bones and muscles, no problem. So it is, I would say it's the hardest course that you'll take in medical school. And the nice thing is continuing to revisit it only strengthens your anatomy, you know. And again, think about surgery, like you're gonna get hit, right, by a surgery. Well, what muscle is this? What innervates this? What embryonic layer did this come from? Because it all matters, and just any touch hour you can get really helps.
If you're interested in OMM as well, this past summer we held a class called OMM Summer Lecture Series, and it's 4 parts long. It's really interesting. You can watch it in like triple speed if you don't want to watch the whole thing over an hour or an hour and a half. So I have cards here. You can pick up my card and email me and just say, hey, I want access to those lectures. Patricia and Kylie, I hope I'm saying your name right, but I'm gonna put my email in the chat really fast so you guys can have it, and you guys can email me if you're interested.
Yeah, and if you guys think of any other questions, that, you know, email Ellie, she can forward it to us.
Yes.
Happy to, it's like I said, very confident for y'all. Like, 'cause I was you, like a few years ago, where like I didn't have a whole lot of how I'm gonna go different places, how I'm gonna do these different things. It's hard. You guys can do it, but it's hard.
So I was thinking about too, we even asked, how many of you guys are interested in pursuing other position or different areas?
What area of medicine do you want to go into? Let me try that.
Yeah, that might be better word for
Peds, ortho,
Family practice rate.
Oh, the internal account.
internal family.
No clue.
No clue, perfect answer. So again, no matter what you do, right, you want to go to Peds, you have Dr. Rogers, you want to go, what?
What is Patricia and Kylie want to do?
Oh, yeah, what are you guys on your list?
She's waiting. What do you guys want to do? What do you guys want to do?
Throw in the chat.
I was told to never pick anything before you tried everything.
There you go.
Oh,
Because you're gonna change.
Yeah,
You'll change 100 times. That's why I say, if you guys ever ask me, like, what do you want to go into internal medicine? You want to know why? Because it really means you can do it. But yeah.
great. I'll say a couple last words and then we'll head out. Like I said, I put my email in the chat for those who are watching on the chat. I've got my card up here. Bottom line for medical school, this is fantastic education, but what it comes down to is it a good fit for you? Do you feel like you're going to be successful? Do you feel like you can follow your passion at ICOM or wherever else you're interested in? And that's kind of the bottom line. I truly feel like ICOM can be it for everybody, but then again, that's my opinion. That's not you. And so if we can help kind of weed out some other options, or if you need further education on ICOM, please feel free to reach out. These guys are fantastic and you can talk to them. I don't even have to be involved. In fact, I don't want to be involved if you're going to talk to them. I think I want you guys to get like true answers and not feel like, oh, they're talking to Ellie. That sort of thing. I'll still be transparent with everything as well. So thank you all for coming. I appreciate it. Again, if you have questions, feel free to reach out, but thanks for our liners. Thank you.
Yeah, if you guys have any questions,
Appreciate
like, you can grab us while we're cleaning up, but
All
good
right.
luck, whatever courses you're in.
Grab some swag. On liners, if you want swag, come into the office for Shannon and grab swag.
Bye.
Bye.
And, you know, and I'm like, well, it's a good thing that literally when